Welcome to the Entrepreneurs Organization EO Wonder podcast, where we bring you the entrepreneurs and thought leaders who amaze, astonish, and inspire. I'm your host, Kalika Yap, an entrepreneur and part of the EO Los Angeles chapter. I'm also your guide each week into diving into the ordinary challenges of extraordinary people. Now, if you're a high-achieving woman, building a company, leading a team, showing up every day for your people, you know the drill. You push through the fatigue, you power past the brain fog, you tell yourself you'll rest after the next million. And maybe you've even gone to the doctor, described exactly how you feel, and been handed a piece of paper that says your labs are normal. Today's guest is here to tell you normal is not the same as optimal. Dr. Shilpa Sayana is a triple board certified MD in internal medicine, obesity medicine, and functional medicine, and the founder of Sayana Medical and Wellness Center in Los Angeles. Born in Zambia, raised in Botswana, and educated at Yale and UCLA, University of Vermont, and residency in UCLA, she has seen health and healing across continents, and that global perspective shapes everything about how she practices medicine today, which is wonderful for a global audience that's listening. She specializes in helping women, especially driven, high-performing women, get to the root cause of their symptoms, optimize their hormones, restore their energy, and truly reclaim their lives. She's a recipient of the Women's Choice Best Doctors Award, multiple peer-nominated honors, and she brings a rare combination of evidence-based medicine and genuine compassionate care to every patient she sees. This one is personal for so many of us. Dr. Sayana, welcome to the EO Wonder podcast.
Thank you so much for having me. That's a special introduction.
So you were born in Zambia, raised in Botswana, got your master's in public health at Yale, and your MD at the University of Vermont before landing in LA. This is a truly remarkable journey across continents. How did growing up in South Africa shape the kind of doctor and healer you became?
Well, first of all, growing up in Botswana, my parents were both physicians, and they were there as foreign aid. Living in Botswana was very simple living. Like there was definitely no social media at the time. There was no internet, and it was a very clean environment. There was no pollution. And so I really didn't have many medical issues growing up there. And now being in LA for more than 20 years, and my kids being born in Santa Monica, growing up in the valleys, they have all kinds of health issues, but so much of it is about our environment. But Botswana and Africa is home.
Oh, and you did a lot of global impact work with AIDS.
Yes. So what happened is growing up in Botswana, I would go home every summer in college, and that was the peak of the HIV AIDS epidemic. And it was just like heartbreaking to see people I knew and their families contract this horrible infection. And it was all about access to antiretrovirals. And so after residency, I was like, I really want to work in the HIV space. So I did an HIV fellowship first, and then traveled to places like Haiti, Nigeria, Russia to teach other physicians how to treat HIV, what the complications you could have, as well as how to get better outcomes. But it was also during this time where I was wearing many hats. A hat of a mother, child to aging parents, running around the globe, and it really took a toll on my health. And that's how I discovered functional medicine.
And that's why you're here in LA?
Yeah, so I moved to LA primarily for the sun, because growing up in Africa, it was nice and warm and hot, and I was used to that temperature. And then I did my medical school in Vermont, and I was like, I don't think I can stay here forever. So I moved to California mainly for the sun, and really, my sister was also here, so that was another impetus to move to LA.
And you came from a traditional practice of 4,000 patients and then opened up your functional medicine practice. Why did you make that switch?
So, when I first started opening my practice, it was after my health issue happened, and I was like, I just want a wellness center. And did conventional medicine and tried to incorporate some holistic medicine into it. Had a busy practice of about 4,000 patients where we tried to do functional medicine and combined primary care, but our wait list was like 4 years long. And it was hard for people to get in because they were just paying a copay of like $15 or $30 and they would come and see us. And then I realized the patients were not getting what they wanted and my whole team was getting burnt out. And then the one thing that completely set us over the edge was insurance companies were telling us, this isn't medically necessary. Why do you have to check hormones? Why are you trying to optimize longevity? Do they have disease? Do they or not? Do they have cancer? Do they have a stroke? Do they have high blood pressure? But that really wasn't a wellness care model. It was a sickness care model. And I realized I didn't want to be part of that.
Were you scared to make that jump?
Terrified. And I think, they say that when you're completely sick of doing something, then you'll pivot. And I was like, I'd rather just go work for Starbucks because this is so not what I went into medical school for. And it's been such a gift to be able to transition and see about providing like real care where you're really there and available for the patient all the time is so rewarding. And both sides, my team is not burnt out and my patients are getting such great results.
What's interesting too, I know a lot of doctors, but for them, they're in this private practice, but they don't consider themselves entrepreneur. This was a very entrepreneurial move for you.
It was huge. And I think trying to learn looking at your numbers a bit better, looking at the data, looking at marketing, and trying to make sure that, you could be doing amazing things, but if you're just a secret, nobody really can benefit from it. So really trying to share the awareness of what you can do and what you should try and empower yourself to do to know what's going on in your body.
So tell us a little bit more about how women can optimize their health, even though they have normal labs.
Yeah, especially women in midlife. When I say midlife, I mean anybody above 35 and higher. A lot of patients come to me saying, I went to my doctor and I had brain fog. The word was at the tip of my tongue, but just couldn't come out. I have to change all my clothes because nothing really fits the same. And I'm really irritable. I'm irritable with my family or with my kids. And I know I am not being myself and I just can't help it. And they'll go to their doctor and be like, this is what's happening. And a lot of them just feel dismissed and discounted. And they'll check lab work and say, oh, things are pretty normal. This is just aging. But it's really about looking at optimal, like you said in the beginning of this show, is you want labs to be in the top quartile of optimal for good labs. For example, like vitamin D, the range is 30 to 100. As a conventional doctor, if you're like 29, I'd be like, that's normal. But in functional medicine, we would like you to be more on 50 to 70. Why? Because it helps with sleep. It helps with hormones. It helps with weight loss. It helps with your bones. It's such an important vitamin to have in your system. Just like your actual hormones, we want those to be optimal as well.
So how did you learn this? Or has it always been in your, essence to really just want to help people?
Yes, I've always wanted to really help and partner with them and figure that out for them. But a pivotal thing that happened was when I went through my own health issue, I was on the other side of medicine as a patient. And I just realized how siloed we all are and how cold the process is. Like as I was kind of thinking, do I have something that's really sinister? And I only had a 2-year-old at that time. Like, would I see her graduate high school? Would I see her grow up? It's such a scary and lonely time. You really want to be able to partner with someone who can reassure you. And that was like, that was a big pivotal change in my practice to be like, I really want to be there for patients all the time. And so that was really helpful to decide what I wanted, how it helped me kind of know the why of me switching my model of practice.
So how did you heal yourself?
So I actually have a benign tumor in my neck. And in conventional medicine, it's like, we don't know why it happened. You have no family history. It's just random. It can't be random. It's like, what's actually happening in my body at the time? And why did this happen? Like, it was such a stressful, exciting period. And I think it completely drained my cortisol, my stress hormone, and caused a ton of inflammation. And that's really what causes to grow. So, and I think in a way, this is there so that I can keep reminding myself not to learn to say no, to really try and be mindful of my own self-care. And how I really healed myself was knowing my own inflammation levels. Like, you have to know your numbers. Because if you don't know if you're inflamed, how do you even heal from that? And you can't work in the dark. I have patients come to me who are taking like 40 supplements. And I'm like, how do you feel? And they're like, I feel terrible. But I'm too scared to stop these supplements because how about if it's helping me? So you have to work looking at data. Because I think just taking pills for the sake of taking them, are they really helping you? So with my philosophy around supplements is take them for a season, for a reason, so you know that they're doing something. But yeah, for me, it was really managing my stress, improving my nutrition. Like in medical school, I got 4 hours of nutrition training. Like, it's just like, how is food medicine if that's all you're getting? But I got so many hours of how to use pharmaceutical drugs. And, if you have a side effect to the drug, what other drug should you take? So that's really the model I came from. And going through my own personal journey, functional medicine is about root cause medicine. Why are you having this at this time? And what is it about midlife that makes you more vulnerable? I have a lot of patients who are like, things I did in the past don't work anymore. Things don't fit the same. I suddenly have prediabetes, or I have slightly high cholesterol. And I think the biggest thing women in general are fearful of is their memory. And that is something that you can do so many things about. First of all, is reducing your inflammation, making sure your hormones are balanced. Then maybe thinking about supplements like NAD, or taking fish oil, or things to really help your brain health. And then kind of having a marker to say, is this working or is this not? Or is this an indefinite supplement forever?
Right. So when you were feeling this sense of burnout, did you feel it like months before and just didn't say anything, or just had this inkling and you just kept on going? Because I feel like a lot of high-performing women may do that.
Absolutely. And I think, I was traveling, and, like most of my male physician counterparts would leave like the weekend before, so they'd get adjusted to jet lag. I would leave like the last minute I could leave because I had a child and I had all these roles back in LA. So I definitely was taking on more than I could. And I knew that, but I was like, wow, I'm fulfilling my purpose. It was so lovely to go to other countries and help these doctors treat so many people. But looking back, I think these symptoms were probably there for a year or two. And I see these reflections in my patients because they all are busy. They're changing the world and they constantly go, 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 go. And they don't really take the time until something breaks down. Then they're like, oh, I really should be paying attention to what's my body trying to tell me. But your body's giving you signals all the time. It's just like, are we listening?
Right. And I know you're a big fan of Dr. Joe Dispenza. How did you discover him?
So I discovered Dr. Joe Dispenza because a few of my patients actually two patients who were on a bunch of supplements, kind of getting a little better, but not so much. One of them went to his 1-week retreat and came back, and I saw her like maybe a month later. She was off half her supplements and her lab work had dramatically improved. And I was like, what? How did you do this? And she was like, I've been meditating. I've been meditating an hour a day. I think when we know the data on meditation, it really helps reset your cortisol, improve your hormones, and it's free. But none of us really do it, spend the time. And a lot of my patients are like, I just don't have the time. But she had come to the point where she was like, something had to give. So she went for this 1-week retreat. And what I like about his philosophy, he says, if you're doing the same things, having the same thoughts, how do you expect the outcome to change? And I see that a lot with functional medicine is if you're going to in the same healthcare system where you're getting the same labs every year, or your wellness labs that look the same and haven't changed, how do you really expect to get better?
Yeah. So I found Dr. Joe Dispenza because one of my entrepreneur friends told me that he was looking at a kaleidoscope and didn't realize he was blind in one eye.
Wow.
He was functioning without any sight in his
Crazy.
right eye. Yeah. And he ended up doing this wellness app, et cetera. But that's how he discovered Dr. Joe Dispenza, because he was working at this other tech company and he went for healing.
That's crazy. Yeah, you see people there from all walks of life. And I know from my conventional medicine colleagues, this is very far out there. They're like, what? We can heal ourselves. So much of it is about stress. Like stress is such a hidden killer. And we don't really frame modern medicine that way.
Yeah. It was so interesting. I was ChatGPTing like, how can you live longer? And ChatGPT said, lower your stress. Like it's cortisol that's killing you.
Completely. That's great.
One
AI.
answer.
Yeah, that's exactly it. And I think that's the thing I tell a lot of patients, like think of your body as a glass of wine. And the level of wine in that glass is your level of inflammation. And as, life kind of throws stresses at you, think of that glass shaking. If the level of inflammation is already really high, a small shake to the glass and the wine will spill out and you will have brain fog, fatigue, weight gain. Your goal in life and good medicine should be how can you lower the level of inflammation, that level of wine as low as you can, so you can be resilient, so you can take whatever life throws at you.
Yeah. So what other tips would you give women who are listening here? Because you tell me, don't cross your legs.
Don't cross your legs. I think a big thing is just being aware of what's happening at this stage of life, that there's a whole new set of rules. And just being aware that what worked in your 20s probably is not going to work in your late 30s and 40s. So really try and listen to your body. Really make sure you honor and prioritize sleep. because we just sacrifice sleep so much. And you really want to get at least 5 to 6 hours of consolidated sleep. So sleep, I would say, is number one. Number two is some sort of movement, stretching. Stretching by itself can lower inflammation. So some sort of daily stretching practice and movement. And with the movement, I think the big currency to longevity is muscle creation. And how can you create your muscle and keep your muscle? So really measuring your muscle mass, doing resistance training, and making sure that you are seeing an improvement there. And I think the three things to making muscle is making sure you're getting enough amino acids, so protein or aminos, making sure you're actually exercising, and having good levels of testosterone. And so I give a lot of my patients microdose levels of testosterone to make sure that they can gain muscle and have good brain function. But to do all of these things, you really want to make sure that container of inflammation is very low so your liver can be ready for tomorrow's prescription dose.
It's interesting. I had my annual checkup at UCLA and I was already on testosterone. And then my doctor said, you know that testosterone is not approved by the FDA?
Yeah. A lot of things are not approved by the FDA. And it's like, and some things are just, if you're going to wait for medicine to catch up, you would have lost all this opportunity to change things. And I tell patients, like, look at the data, look and see, and look at yourself. Like, you're going to take this supplement or you're going to take this hormone. How do you feel? And what are your numbers saying? Are they getting better? Are they improving? Do you feel stronger? Are you seeing your BIA machine where you have more muscle mass than body fat? Let the data of your own story guide you than a government agency.
Yeah, that makes more sense.
Yeah.
Yeah. Especially if you're seeing low testosterone levels.
For sure. And with hormone replacement, last year the FDA took out its black box warning, which is amazing. A lot of women now can have access to hormones. And I think it's wonderful, but I also think the pendulum is swinging and swinging and swinging because a lot of women can just get this stuff online. It's accessible and you get all these hormones delivered to you. But I do think it's important to check levels because in conventional medicine, we don't check hormonal levels because we're just going to give you the hormone prescription, usually estrogen, progesterone, just depending on symptoms. But I think it's important to measure those because those hormones go through your gut, they go through your liver. You want to make sure you're on the correct and optimal dose.
So how did you learn all this? Is it through continuing education?
You know what? The biggest gift of how I learned all of it is through having such a high volume of patients. So when I had my 4,000 patients, I did functional medicine primary care for all of them. And so it was really, and that's really, I did the functional medicine certification. I learned all that. And at that time, the functional medicine certification was restricted to just providers. So it was a much more about doses and supplements. And then it kind of evolved to be more lifestyle driven. But when I learned all those prescriptions and supplements, I could really give it to my patients and I would give them ashwagandha or give them a blend of supplements. They would come back and I would see their numbers improve. And so I had such a high volume practice. So my real teacher was my patients.
And also probably your desire to want to
help.
help.
And I really wanted to help. And that's how I landed up with all these board certifications. It was like, internal medicine was key. Then I did my HIV certification and then I did my obesity medicine. And I was like, well, why can't people lose weight? And functional medicine is what tied it all together because it gave me the skeleton and the framework, which I'm very familiar with internal medicine, which is check the lab, see if it's getting better. But it really explained to me a systems approach of the why. Like, why is this happening and how much the mind and the body is connected? And so many times I would treat people's gut health and their depression would improve or the anxiety would get better. So this whole gut-brain connection, I think, is extraordinary. I think for women out there, empower yourself to know your genetics. And how I explain it is conventional medicine is very linear. Like you have a urinary tract infection, you're going to get an antibiotic. You have you have acid reflux, you're going to get an antacid. But functional medicine is more triangular. So the base of the triangle is the genetics you came in with. And just because you came in with the gene, it doesn't mean they need to manifest. And that's the key thing is this whole epigenetic concept is you can switch off these genes. How do you switch off these genes? Is the other two parts of the triangle. Is the mediators or stuff that's fueling it, like processed foods, toxins, antibiotics. And then the tip of the triangle is triggers or stressors. And stressors could be as simple as I work and I travel for work all the time and it's stressful to travel, or it's a divorce or a death of a loved one. But it's that triangle that is really important. So how that triangle applies to my life is genetically, I know I have the ApoE gene, which makes me 6 times more likely as somebody who doesn't have it to get Alzheimer's. Conventional medicine, I have nothing to offer myself except exercise. But in functional medicine, I know if I reduced my toxic burden, if I increased my muscle mass, if I reduced inflammation, and if I optimized my hormones, the likelihood of me getting Alzheimer's is much lower.
And if you play mahjong.
Yes, exactly. And community is so important. And we play mahjong together. So that's why prioritizing that and how fun it is really important for brain health.
I was listening to a longevity podcast, and they said, if you won the gene lottery, meaning your parents have lived to 90 or 100, like that is the foundation. And then everything else is you're sort of just supporting that foundation.
Completely. So and then with the Alzheimer's gene, neither of my parents have Alzheimer's. My one grandparent did. And my mom has the dementia gene, but no, the Alzheimer's gene, but nobody in her family has Alzheimer's. But she does a lot of lifestyle stuff to make sure that gene never gets switched on. I also have the osteoporosis gene, and my sister doesn't have it, but I do. My mom has osteoporosis. So really trying to prioritize resistance training is important. Prioritize protein, prioritize movement. So having knowing those genetics is helpful.
There's also a lot of talk about taking creatine, but is that, and also are these different ways to treat people? Is it also gender specific?
Yeah, I mean, it definitely is gender specific in terms of how much hormone you'd give someone or how much creatine you'd recommend. But I think creatine can be very beneficial for brain health, can be super beneficial for inflammation and oxidative stress. But I think it's very important to monitor your kidney function. And that's where I think a lot of people are taking a lot of things without monitoring. And that's when I saw with my high volume patient, supplements are amazing. They're also powerful, which means they can have side effects. Like I'll never forget this one story of a patient. She came to me, I had maybe seen her for a couple months, and she said she was going to be getting a bone marrow biopsy because she had low platelets. And so I was like, okay, they were doing this. And she said she was been to UCLA, with Cedars. They were doing all these multiple tests on her. And then we looked at a complete supplement list. And I was like, did you share this with any of them? And she was like, no, I'm fearful to tell them that I'm taking supplements because they'll tell me to stop. So this whole, we'd really try and blame patients for taking supplements and create this barrier where they don't feel comfortable and they feel judged. Yeah, exactly. So I looked through her supplements, and she was getting 4 different sources of green tea extract. And such high green tea extract can cause thrombocytopenia, which is low platelets. So I was like, just stop this green tea extract and give yourself 6 weeks before you do anything. She stopped these supplements and her platelets normalized. So as supplements are so important, don't forget the power, and please share with the doctor what you're taking. And if you're fearful, then that's not the right doctor.
Yeah. So did you suggest matcha later?
Yeah, matcha is totally fine. These supplements are all good in small doses, and provided you're monitoring. It's important to know how your body's receiving them, because my genetics may be different from your genetics in terms of how we process it. And my gut may be different from yours. So it's important to know what your body is capable of processing and receiving.
Yeah, and also knowing, because I heard, I was watching that the Gut Health movie, and it said that taking antibiotics can really ruin your gut health. And a lot of people use antibiotics as just their way to go.
Antibiotics, and people just don't realize the impact on it. And especially antibiotics in young childhood. Like if you've had antibiotics before the age of 5, it really sets you up and sets your gut up to have more issues with mental health later on, like anxiety and IBS and irritability. So really try and preserve antibiotics. If you really need them, obviously we need modern medicine. But if you can do other things first, like high dose vitamin D, C, immune support, try those things first. But the biggest thing that protects our immune system is sleep.
Yeah. Do you have any tips for sleep?
Yeah, a couple of things for sleep. Sleep hygiene is important, which is make sure you're not having the blue light. A couple hours before sleep, try and have a sleep ritual. I think those things can become very impractical for patients. So I think the most important thing I would say is have a sleep bedtime routine. Like this is the time you need to sleep. Other simple things you could take for sleep is magnesium. It's just a muscle relaxant. It's super helpful. If you know that you're feeling like wired and yet really tired, think about things that drop your cortisol, like ashwagandha or Relora. But with sleep, it's so important to prioritize. And the one thing I think that's commonly overlooked is progesterone. Especially if you're in midlife, progesterone can really help but you need to work with a physician who's checking your levels. Because if you're under a ton of stress and running around, there's this concept called cortisol steal, which is a cortisol is stealing your progesterone, because you always support the survival hormone cortisol. So if you are taking progesterone and you were sleeping and then you suddenly realize you're not sleeping as well, your cortisol is probably stealing your progesterone. So check your level and make sure your progesterone is ideally above 8 to 12. And then you know, okay, you have a good enough progesterone. And if it's not, try increasing the dose.
What about red light therapy before bed or?
Yeah, I know red light therapy, PEMF, doing yoga, stretching, all that stuff is so helpful. I just find a lot of women don't prioritize themselves. They just don't. They prioritize their kids, their husbands, their families. But small hacks like red light and having a sleep hygiene routine can be super critical, or even just stretching.
Yeah. What about IV therapy? What do you think about that?
We do a lot of IV therapy in our practice. When we had 4,000 patients, we did it a lot. But our IV therapy was mainly using things like Myers cocktails of vitamin C, B complex. But IV therapy should be done for a season and for a reason, meaning that if somebody's really inflamed, the gut's really inflamed, they're not absorbing their nutrients, yes, IV therapy can be super helpful. What I find with a lot of people who do it often is they do injure their veins, because after one vein, they'll go after the second vein. But there's some things that through IV therapy can be really magical, like NAD, that really does help with your brain health and memory. IV iron, we do a lot of IV iron in our practice because we have a lot of patients who are vegan. And a lot of our patients who are not vegan, but have a lot of gut malabsorption due to an infection called SIBO, small intestinal bacterial overgrowth. And symptoms could be bloating, could be fatigue, kind of subtle. 50% of my patients with SIBO don't even have any symptoms. But if you have SIBO, you're not absorbing your nutrients and not absorbing your supplements. So for patients like that, we will treat their gut and give them some IV iron or nutrients, just help them feel like a little more human and feel like they have some energy.
Wow, that's a lot to work. What is your daily routine like?
My daily routine on a really good day and a good week is really getting to sleep at a good time. There's this whole concept in Ayurvedic medicine that if you can get into bed by 9:30 and be asleep by 10, it can be really helpful because the second wind of Vata happens after 10, which kind of keeps you more activated. So I try to be asleep by 10. Things I really enjoy doing is using a sauna. So we use an infrared sauna because I have genetics that don't detoxify well. Live in LA. So using a sauna is something I try and do at least once or twice a week. I do resistance training at least 2 to 3 times a week. And during the day, a lot of it is breath work. I really enjoy doing some pranayama, which is like a deep breath into your nose and out it from the other side, doing some humming, especially in LA traffic. I see so many people like upset and angry at each other. And I kind of wonder like they're not helping their cortisol. So doing some humming, doing more breath work is easy, it's free, and it's so accessible.
Yeah, we're doing a pranayama session for Harbor Westlake Mindfulness Club next month.
That's great. Yeah. I think people just don't know about it.
Yeah.
But if you do know about it, I think it's such a simple tool.
Yeah, one of the tools is to just close one of your nostrils, breathe in from one side, and then let it out on the other side. It's very calming.
Completely. And then another one that's been shown to have good benefit is humming. The whole concept of just like closing your mouth and going, that whole humming, the longer you can hum from, all it's doing is actually causing vibration in your jaw and activating your vagal nerve. So it's kind of really putting you more into this parasympathetic, less fight or flight that we're all living in daily.
So you mentioned Vata, which is one of the dosha types in Ayurveda. Can you talk a little bit about the other dosha types?
Ayurvedic medicine, I wouldn't say I'm an expert in. Vata is something that I learned through my American Board of Integrative Medicine, and then Kapha and Pitta. So much of Ayurvedic medicine makes a lot of sense because it's about knowing your type and knowing what kind of foods to eat. Like as a Vata type, you're having more cooked foods, having more foods that are warm and nourishing. And it's fascinating that there's 4 types, that each person is one of these types, and how you can change your diet and your routine just based on that, and how you actually kind of thrive better in the world doing that.
Yeah, so I'm Vata Pitta. And then when I got my assessment, they said exercise, doing yoga is really grounding because Vatas are very much in the air.
Yes, exactly. Yeah. And I think it's fascinating to see what's out there. And people always talk about the blood type diet. Should I eat for my blood type? Should I eat for this? And I think a lot of kind of doing stuff like that, you should just do it in moderation and see like what intuitively makes sense for you. Because I find even with functional medicine, I have people come in who are like, I don't have gluten, I don't have dairy, I don't have sugar, I eat no seeds. And then I'm like, what are you eating? And I'm vegan. And so it's important to say, and food is such a social thing. You want to be able to eat and be able to be in community. So see, your body is more resilient than you realize. So try and work on other aspects of inflammation and then change your diet to make sure you're nourishing yourselves, especially with really colorful vegetables, fruit, fiber, and protein. I think in the day of GLPs, where everybody's maybe on injections to lose weight, I think the common thing I see in functional medicine is malnutrition. They're not hungry and they're not eating.
And they're losing their
Yes, they're losing their hair because they're malnourished. And so it's important to make sure you're nourishing your body.
Yeah. I know that has been a real transformation, in the United States. When I went to Disney, you were asking me last week, I noticed that there were less obese people.
Right. I mean, it's changed, I think, our whole economy. Yeah, the GLP drugs they really can change people's destiny, like genetic destiny. But I think they should be used cautiously and used with lower dose first. Start with the lower dose. You may not need the full dose, and do it at a time when your gut is not inflamed, because it does slow your transit time in your gut. And if you have things like SIBO that already slows the transit time and you have all this bacteria sitting around, you don't want there to be slower time where the bacteria can feast on your food. So it's important to do lower dose, make sure that you're not having side effects such as stomach pain, which could be pancreatitis. Make sure you're not constipated. And I think the most important thing is make sure you're nourishing your body and able to eat.
Yeah. And I love because you're a vegetarian and you always gravitate towards vegetables and fruits.
Yeah, I think, looking at colorful, and I usually, the big hacks, I think what anybody could do is make sure you're getting ready on the weekend. Like on Sunday, a lot of our time as a family spent, where are our fruits? Where can we put them in little containers? So it's easy to gravitate to during the week. Another quick hack that I think has been amazing is trying to get enough protein and fiber. So we just use like a good high protein yogurt. And in there, we add like a whole container of it. And we add 7 tablespoons of flax, 7 tablespoons of chia, and 7 tablespoons of hemp. Mix it all really well together. You can add collagen if you want, and then put it into little ramekins so that the next day they're ready for you to eat. And you could add honey, you can add nuts. It's a delicious snack that's already made for you.
And it's yummy and it's
yes. So I think that you try to look for simple things that you can prepare ahead of time. So if you don't prepare, you will fail.
Yeah. And besides being an entrepreneur, you're also a mom of 2.
Yes.
Yeah. So Maya's a prefect at Harvard Westlake. So impressive. And your other son is...
he's in middle school. He had to go to college. And I think for a lot of my patients, this stage in life is their kids are leaving to college or they're caring for older parents. But it's also just a time of like gratitude. I'm grateful for where they are and grateful for them to realize how much privilege they've had to become responsible humans.
Yeah. So how do you balance it all? I know everyone hates that question about balance, but how do you manage your family life with your husband and having a business? So much
is like what you did with us at the beginning of the year is setting intentions. Like, what's really important this year? What do you want to see in this quarter? How much time do you want to spend with your kids, with your family, and with in your work? I don't think anybody says, on their deathbed that they wish they worked more. But an intention for me, the beginning of this year, is to do a date with each one of my members of my family. So we do a 2-hour date, and with our kids, I'm like, it shouldn't involve money. So we go to the park, or maybe it's like go to Color Me Mine, do something small. But we've been trying to do it for once a month with each of them, and it's been a real game changer. It's like quiet, like it's a date time. We've set aside this time to spend time with each other. But I think it really helps, especially when you're busy.
Yeah, to have that intention. Yes. And they're all for it. They're all for
it. In the beginning, they were like, And now they're like, look forward to it. Mom, we haven't planned our date. And I was like, yeah, we haven't. So it's good. I think it's important as moms, as busy women, to really make sure that they know that they're a priority.
Yeah.
And don't forget to prioritize yourself. I think having a date with yourself where you can be in nature, be around community is so important.
So we're in 2026. What are you looking forward to this year?
This year, I think my biggest thing I'm looking forward to, so I changed my model over the past 2 years, went from a really busy practice to more of a small boutique concierge functional medicine primary care practice, is really trying to figure out how to scale accessibility to functional medicine. So just last week, this week actually, I did my first webinar where I taught people what functional medicine is and some common ways to read their normal labs. Like, look at your lab work. Let me tell you what optimal looks like and what normal looks like. And then from there, we are doing a 6-week lab course where it's really understanding. So I order the labs for a group of people, and as a group, I teach them what these labs mean. I think my vision for 26 is how to scale that. So how to do just the longevity hormone labs, how to do something on gut, and how to do something on genetics. They're like 3 pillars in functional medicine. And I think if we could scale that, make it a little more accessible, then a lot of people could have benefit. So that's 26 for me.
And you have a lot of webinars scheduled for the future?
I do. We have one every month scheduled. The next one is in March, and then the next one's in April. But these webinars are just a portal where people who are interested can be open-minded about saying, is there something different for me? Are my labs really normal?
Are they able to register on your website?
Yes, they're able to register on our website. They can go to www.askdrshilpa, or they can go to Sayana Medical, or just look me up on Instagram, and my handle there is Ask Dr. Shilpa MD. And they could sign up there. It's easy to sign up, and it's free, and it's just a place you can get more aware and more educated, and most importantly, more empowered.
And what's great is it's available globally. So
Yes.
anyone, they don't have to be in LA.
They don't have to be in LA. They can come to the webinar and learn. And then by the next 6 months, in terms of 26, I plan to get licensed in more states, because to order the labs and to take their responsibility, you have to be licensed. So I really like to do that to really scale and make functional medicine more accessible.
Wow, that is so impressive. Do you have any other tips for the entrepreneurs that are listening today?
Yeah, and I think that as entrepreneurs, you're a special breed. To get to be an entrepreneur, you have to be kind of hyper-focused and always on. But I think that itself can be a danger and detriment to your health. So just be aware of that and make sure you're taking time for yourself. And really, again, I don't think we spend enough time as women really tapping ourselves on the back and saying, hey, we've come, look how far we've come. So spend some time just reviewing how far you've come and being really proud of yourselves. And try and invest in community and a sisterhood. Because after a while, if you have kids, they're probably going to be gone. And I think that really helps, again, prevent any risk of Alzheimer's.
Right. Yeah. And also, too, I think as entrepreneurs, we take a lot of intelligent risks, which then, does cause some stress.
It does, and even and a lot of times patients are like, I'm not stressed, I feel fine. But it's all these micro cortisol peaks that accumulatively added up. And then that's the same thing as having one big event. So a lot of times people think of stress as like, oh, it's a big thing. Nobody died around me, or I didn't get divorced. But it's all these small things, being in LA traffic, taking that intelligent risk, wondering, is this going to work? All of that adds up.
Yeah. And also ask for help.
Yes, ask for help. I think one thing that's also in terms of giving me the courage to change my model is having good mentors. So there are people who've done this before, and success leaves clues. Look around, see who you really want to be like. Who do you want to emulate? And those are the people you can look for, and look for mentorship. There's a lot of people out there who want to help, who generally want you not to make their mistakes. So
who do you want to emulate?
I would love to emulate. There's so many different amazing people out there I've learned about in my global medicine track, but even just the ability to articulate complex medical terms into simple terms. I think people I can think of is Dr. Sarah Godfrey, Dr. Mark Hyman, but even the doctors I'd met in places like Uganda and Haiti, they were really smart doctors. They relied so much on physical examination rather than our expensive lab tests. But just being able to give them the tools of what I had, the privilege of functional medicine, I think would radically change their whole patient populations. So I'd love to really empower them.
Yeah, because the doctors end up being educators.
Correct. And that's a big thing. Anytime you're on the healing side, you are an educator, and just making people aware. Because I think when you're in the frame, it's hard to see the picture.
Yeah.
You need somebody else to be like, oh, I think I should really try this. Somebody you trust and somebody you can partner with.
when I was the Entrepreneur's Master's Program at MIT, what they gave this metaphor of a little fly looking through a glass, and then sort of someone else just telling the fly, just go to the left, and there's the window. And because the fly doesn't realize, like, it just looks
It's
like
all
you
the
could
same.
go forward, but you're stuck.
Exactly.
Yeah. And like you said, like,
Yeah.
you're
You're in the frame. How can you see it?
Okay.
But that's why I think mentorship and asking for help is critical.
Yeah.
And asking for help even at home, like, managing things at home with just one person. And this whole concept where women think they can really do everything, yeah, you probably can, but at what cost?
Yeah. So everyone, you can ask for help at Ask Dr. Shilpa.
Yeah. Feel free. Ask Dr. Shilpa MD is my Instagram handle. Please ask, and I hope to answer. I'm really trying to make this more accessible.
Thank you so much for being part of this conversation. Everyone else is going to be really appreciative for all the info that you gave us today.
Absolutely. Thank you so much for having me. It was fun to be here.
Thank you.